Cervical dilation is something that gets talked about a lot when it comes to birth. You might have heard stories about people being stuck at 4 centimeters or of people being only 1 centimeter dilated. But what does that actually mean? And can dilation actually tell us how close we are to giving birth? Do cervical checks really give the full picture? In today's video, I am going to break down the truth about cervical checks, also known as vaginal examinations, and all about dilation. If you're new to my channel, my name is Ruth. I am a hypnobirthing instructor and also a very busy mum of 3. If you are currently preparing for your labour and birth, do go ahead and follow my channel. I am all about preparing couples to have the best possible experience of birth, and I'm also just extremely passionate about giving women their power back and their voices back in birth so that you feel in control and confident. So a cervical check, also known as a vaginal examination, is when a midwife will insert 2 fingers into your vagina to assess how dilated your cervix is and how thin or effaced it has become. They might also check how soft your cervix is, what position it's in, and also to see if baby's head is low down in the pelvis. These cervical checks usually happen during your labour, when you're in hospital, in a birth centre, or if you're about to go through the process of an induction. They're used to assess the progress of your labour. But here's the thing. Dilation is not a reliable way to predict when your baby is going to be born. A lot of people assume that being a certain number of centimetres dilated means that your labour is either speeding up or slowing down, but that's not always true. You could be 1 to 2 centimetres dilated for days before your labour actually kicks in. And some people go from 3 centimetres dilated to birth within a matter of hours. Labour isn't a straight line, and it's different for everybody. One person might dilate gradually and slowly over several hours, and another might stay the same for ages and then suddenly progress very quickly. So if you ever hear someone say that during their labour they were stuck at 4 centimetres, it's probably more than likely that they weren't actually stuck at 4 centimetres, but their body was just taking the time that it needed to progress in labour and birth. So I get asked this a lot, and the answer is no, you do not have to have cervical checks. They are always your choice. You have the right to say no to a vaginal examination. You can ask for an alternative option, and you can absolutely request a different approach if you do not feel comfortable. Some people can find vaginal examinations reassuring, but for others, they can be stressful or painful and uncomfortable. They can even slow your labour down by triggering your fight or flight response. So if you're having a vaginal examination and it's making you feel fearful and really tense, your body will start to produce adrenaline, which will block the flow of oxytocin, which you need to drive your labour forward and to encourage your uterus to contract. I personally have experienced vaginal examinations in 2 ways. In my first labour and birth, I did get the comment, "You are only 4 centimetres," several times, which made me feel really deflated. I found them very painful, very uncomfortable. I found that they set me back more than helped me to move forward. However, in my 3rd labour, where I birthed at home, once I fully understood my body and how my mind and my body connected and how birth really works, I used my cervical check to my advantage. I requested 1 vaginal examination where I was told it was 5 centimetres, and for me it was a positive experience, and I was able to use that number to actually spur myself on for the rest of labour and to encourage myself to relax even further to help my labour progress. So there are times when a cervical check might provide some useful information. Many hospitals have policies in place where they require that a vaginal examination is carried out before they can offer you particular types of pain relief, especially an epidural, so that they can assess how far along you are in your labour. It doesn't mean that you have to have one, but it's just something to be aware of if you are planning to use more medical types of pain relief. Another situation where a cervical check might be helpful is if you are showing signs of having a cervical lip. This is where a small part of the cervix is still in the way as the baby's head is trying to move down. Sometimes this can resolve on its own, but in other situations, a midwife or a doctor might suggest different techniques or different positions to try and help move it out the way. So how do you decide whether to have a vaginal examination in the moment that you are being offered one? And yes, you should always be offered one. They should never come in and just say, right, we're going to do a vaginal examination. They should ask you, and you should be able to make an informed choice about whether you are going to accept or not. So a great way to approach any decision in labour is to use the acronym B.R.A.I.N.S. Now, I have a whole video on this, which I will link below. It's how to use B.R.A.I.N.S so that you can make informed choices during your labour and birth and also during your pregnancy. But I'm going to demonstrate here how you would use it to make a decision about having a vaginal examination. So what are the benefits of having this vaginal examination right now? Will it help you access the pain relief that you're requesting? Or will it give you useful information? What are the risks of having this vaginal examination? Could it cause discomfort, stress, or could it lead to other forms of intervention? What are the alternatives to having a vaginal examination? Some midwives can assess your progress without an internal examination. They can observe your behaviour, listen to the sounds that you're making, or even check for the purple line. The purple line is a natural marking that appears between the buttocks as labour progresses and can tell you how dilated you are. What does your intuition say? What's your gut telling you? Do you feel like you need this check right now in this moment? What happens if you do nothing? So what will happen if you don't accept this vaginal examination? Will waiting a little bit longer make any difference? And you can also put a timescale on that. So you could say, what if we do nothing for another hour? Or what if we do nothing for another 2 hours? And then can you come back and ask me if I'd like to have a vaginal examination? Smile and stay calm. You are in control of your own choices. So cervical checks are one way to assess your labour progress. They are not the only way. And if you're ever unsure, you can always ask. Do not be afraid to ask questions. What will this check change? And do I really need it right now in this moment? So instead of focusing on numbers, a better way to assess your labour progress is by looking at your body's signs and your behaviour, how you're breathing, the sounds that you're making, how you're moving. Midwives often say they can tell how close someone is to birth just by observing them and not by actually physically checking them. So if you're ever offered a cervical check, it's completely fine to ask, what will this information change? And do I need to have this check right now? Labour isn't a straight path, and everybody will experience something completely different. Your body knows what it's doing, and you are always in control of what happens to it. So the truth about vaginal examinations, they're not always necessary. They cannot predict when your labour will start or how long it will be. They cannot tell you when your baby will be born, and they are completely optional. Did you know that vaginal examinations were optional? Leave me a comment below. If you found this video helpful, please do hit the like button. Make sure that you subscribe to my channel so you don't miss any of my content. I upload weekly content with lots of tools, tips and techniques for labour and birth to ensure that you have the knowledge, to ensure that you feel powerful and confident, and you can work with your birth partner as a team. Thanks so much for watching. I'll see you on my next video. Take care. Bye-bye.